Welcome to the deep dive. Today we're tackling something you might associate more with dogs, actually, but it definitely affects cats too. We're talking about intervertebral disc disease, or IVDD.
That's right. You hear slip disc, you probably picture a dachshund, maybe.
Exactly. But cats get these back problems too, so we're here to kind of get a clear picture of what IVDD looks like in cats.
Yeah, we've dug through the information to pull out the really key stuff.
Right. Our mission for this deep dive: what is feline IVDD? Which cats might get it, what are the signs, and crucially, what can actually be done about it.
Let's jump in.
Okay, so let's start right there. What exactly is happening in a cat's spine with IVDD?
Okay, so fundamentally it's about those little cushions, the intervertebral discs that sit between the bones, the vertebrae, in the spine.
The shock absorbers.
Precisely, and the problems start when these discs get damaged or, degenerate. This can then impact the spinal cord running through there.
And you mentioned it's maybe not quite the same as in dogs.
Well, the interesting thing is cats seem to show a few different patterns of disc problems. It's not just one thing.
Okay, different patterns. Tell me more about that.
So first, there's what we call type I. This involves changes inside the disc in the nucleus pulposus, that inner bit.
Right.
It undergoes something called chondroid metaplasia and mineralization. Basically, think of the gooey center hardening up, almost like turning into a piece of hard candy.
Okay, so it gets hard and brittle.
Exactly. And then that hardened material can burst out or extrude. That's type I extrusion.
Got it. Hardening, then bursting. What are the other ways it can happen?
Then you've got type 2. This is more about the outer layer of the disc, the annulus fibrosus. Instead of hardening and bursting, it weakens, it gets sort of fibrous, and it bulges outwards, a protrusion.
So a bulge rather than a rupture.
Yeah, it pushes on the spinal cord gradually. And then there's a third type called acute non-compressive nucleus pulposus extrusion. Bit of a mouthful. This one's different again. Normal, non-hardened disc material suddenly bursts out. But the key thing is, it doesn't cause ongoing pressure. It's more like a sudden blow, a concussion, to the spinal cord.
Okay. So the end result might be spinal cord injury in all cases.
Yeah.
But how it gets there, well, that can be quite different between these types, and maybe different from dogs, too.
Absolutely. And knowing the type can kind of guide things, Type I might happen really suddenly. Type 2 might be slower. It matters.
That makes sense. So who are we talking about here? Which cats tend to get these issues?
Well, the information suggests the average age for cats with these sorts of disc problems is around 8.4 years old.
Okay.
But that's just an average. The range is pretty huge, actually, from as young as like 1.5 years old right up to senior cats, 17 years.
Wow. Okay. So not just an old cat disease then.
Not necessarily, although it's interesting, if you look specifically at cats with that type I, the mineralized kind, their average age is a bit lower, about 7.3 years.
So maybe that hardening type hits a bit earlier in their mature years.
Seems that way, yeah.
And what about breeds? Is it like dogs where certain breeds are just much more likely?
Well, that's a key difference we'll come back to.
Yeah.
But mostly it's seen in, your regular domestic short hairs and long hairs.
Right.
There are some reports in purebreds, oriental breeds have been mentioned specifically. And then there was that one really unusual KISS report. A tiger.
A tiger?
Yeah. Seriously.
Yeah. Obviously very rare, but it shows it's not just a domestic cat thing. But importantly, it doesn't look like there's a sex difference. Males and females seem equally affected.
Okay, so middle-aged on average, but could be younger or older. Mostly regular domestic cats. No obvious boy-girl split. Good to know. So the big question for owners, what signs should they be watching for?
Right. So most cats, because the problem is often in the lower back, the thoracolumbar or lumbosacral area, they show signs in their back half.
Makes sense.
So you might see weakness in the hind legs, maybe even paralysis. You might look uncoordinated, wobbly, that's ataxia.
Like they're drunk. Kind of, yeah. Or they might walk funny, limp, or suddenly stop jumping up on things. That reluctance to jump is often a big clue for cats.
Right, because that's such a core cat behavior.
Yeah.
If they stop jumping, something's usually up. What if the problem is higher up, like in the neck?
Good question. If the cervical spine, the neck, is involved, then yeah, you could see signs in all 4 legs.
Okay.
And another important thing, these signs can pop up really suddenly, like overnight, that's acute, or they might develop more slowly, gradually over days or weeks. That'd be chronic.
So it varies. Are there other things besides just leg weakness?
Oh, yeah. Back pain is a big one. Though, cats, they're experts at hiding pain.
Tell me about it.
So maybe they just seem withdrawn or they don't want to be picked up, maybe cry out when you touch their back. Other things can include problems with urination or defecation, like incontinence.
Oh, dear.
Yeah. Or changes in their tail carriage. Maybe it's limp. In really severe cases, they might lose feeling in their legs. And if it's a bad neck injury, it can even affect their breathing, make it shallow.
Wow. Okay, any of those signs sound like a definite vet visit, ASAP.
Absolutely. No waiting around with neurological signs.
Okay, so we know what it is, who gets it, what it looks like, but why does it happen in cats? Are there known risk factors like we see in certain dog breeds?
This is where it gets really interesting and quite different from dogs. As we said, that type I degeneration, the hardening and extrusion, seems to be the most common scenario in cats.
Right.
But, and this is the crucial bit, unlike dogs, your dachshunds, your Frenchies, we haven't really identified clear breed predispositions in cats.
Huh. So it's not like being a specific breed makes a cat way more likely to get IVDD.
Doesn't seem so based on what we know now. The underlying why might be different. It's not necessarily linked strongly to genetics in the same way.
That's fascinating. Does it tend to happen in a particular spot in the spine more often?
Yes, it does. Similar to dogs, actually. The lower back area from about the 11th thoracic vertebra, T11, down to the start of the tailbone, S1. That's the most common zone. There's a theory that a ligament found higher up in the chest area, the intercapital ligament running from T1 to T10, might give that part of the spine a bit more stability, a bit more protection.
Interesting. So no obvious breed risks, tends to be lower back. Okay, let's say a vet suspects IVDD. How do they confirm it? What's the diagnostic process like?
Well, first step is ruling other things out, what we call differential diagnosis, because other conditions can cause similar signs, right?
Like what?
Things like physical trauma, maybe they fell badly. Blood clots are a big one in cats, causing sudden paralysis like saddle thrombus. Cancer, especially lymphoma, can affect the spine. And certain infections like FIP or cryptococcus.
So quite a list to work through. It's not always immediately obvious it's a disc issue then.
Not always, no. A thorough neurological exam is key. Usually basic blood and urine tests come back normal, which kind of helps point away from some other diseases.
Okay, so then you need to look at the spine itself.
Exactly. And that's where imaging comes in. Advanced imaging is really essential.
What kind of imaging techniques are we talking about?
Well, x-rays are often done first. Sometimes
Okay.
they show clues, like maybe the space between vertebrae looks narrower, or you might even see mineralized disc material, either still in place or maybe bits that have moved into the spinal canal.
So x-rays can sometimes help.
Sometimes. But often we need more detail. Myelography is one option, injecting contrast dye around the spinal cord, then taking x-rays. That can really show where the cord is being squeezed.
Right.
CT scans are also good. They show bone detail very well and can spot compression and mineralization. But really, MRI is often considered the best tool.
Magnetic resonance imaging.
Yeah. MRI gives amazing detail of the soft tissues, the spinal cord itself, the disc material. You can see swelling in the cord, the exact location of the disc extrusion or protrusion. And a key thing with MRI is that mineralized disc material looks dark on all the different types of images we take.
So MRI really gives the clearest picture. Are there any other tests?
Sometimes analyzing the cerebrospinal fluid, the CSF, is done. Usually in cats with straightforward IVDD, the CSF is pretty normal. Maybe a tiny bit of blood contamination if the needle nicked something, but generally unremarkable.
Right.
The absolute definitive confirmation of the type of disc problem, though, often comes from looking at tissue samples taken during surgery, if surgery happens.
Okay, that makes sense. So let's say the diagnosis is confirmed. What happens next? What are the treatment options for a cat with IVDD?
Okay, so if the disc material is actively pressing on the spinal cord, that's compressive disease, then surgery to remove that pressure is generally the most effective approach.
Spinal surgery.
Yep. There are different surgical procedures like hemilaminectomy, ventral slot, lateral corpectomy, depending on exactly where the problem is. The goal is always to decompress the spinal cord.
That sounds pretty major. I assume there are risks involved.
Oh, absolutely. And it's vital the vet discusses these thoroughly with the owner beforehand. Risks can include bleeding, potential damage to the spinal cord during the procedure, maybe infection, or even creating some instability in the spine later on.
Right. Owners need to be fully informed. What about after the surgery? What's recovery like?
Post-op care is hugely important, really critical. Making sure the cat is kept comfortable, turned regularly if they can't move well, Good pain relief is essential.
Hmm.
Bladder management is often needed too. Many cats can't urinate on their own initially, so maybe a catheter or the owner learning to express the bladder manually. And physical therapy is key for regaining strength and function.
Sounds intensive.
It can be. And sometimes if the surgeon sees other nearby discs that look mineralized and may be risky for the future, they might talk about addressing those proactively at the same time.
Trying to prevent another episode. What if surgery isn't an option? Maybe the cat isn't a good candidate or the owner prefers not to go that route.
Medical management is an alternative. This mainly means strict cage rest, really limiting movement, combined with pain medications, maybe anti-inflammatories. This might be tried for cats who can still walk, albeit poorly.
So rest and meds.
Yes. But for cats that can't walk, or those who are getting worse despite rest, surgery is usually strongly recommended because it generally gives a much better chance of a good outcome. It's worth noting that using steroids, corticosteroids, hasn't really been proven to be consistently helpful in feline IVDD.
Okay, so surgery seems often the preferred route for more severe cases. Looking ahead, what's the long-term picture after treatment, whether it was surgery or medical management?
Well, frequent checkups, neuro exams are important early on to track progress. And then that strict cage rest we mentioned, that's usually needed for about 4 to 6 weeks for both surgical and medical cases.
4 to 6 weeks is a long time for a cat.
It is, but it's crucial for healing. After that, it's a very gradual, controlled return to activity, often guided by physical therapy exercises.
Do we know if keeping them less active long-term helps prevent it coming back?
That's actually unclear. We don't have solid evidence that long-term activity restriction after recovery makes a big difference in preventing recurrence in cats.
And speaking of recurrence, how likely is it to happen again?
Yeah, that's a common worry. Because IVDD isn't diagnosed as often in cats as in dogs, we don't have really great statistics on the recurrence rate. It's considered less common than in dogs, but it can happen. There was that one case report of a cat needing a second surgery later on.
So it's possible, but maybe not super common.
Possibly. Another important long-term point is bladder function. Some cats, even if they recover walking ability really well, can have lingering urinary incontinence issues.
Oh, really?
Yes, and owners might need to manage that long-term, like expressing the bladder several times a day. It's a significant commitment.
That's a really important thing for people to be aware of.
Yeah.
But overall, despite those potential challenges, what's the general prognosis?
Generally, it's actually quite encouraging, especially with surgery. Most studies show that the majority of cats treated surgically, even some who had lost deep pain sensation initially, which is usually a poor sign, have good to excellent outcomes long-term. They get back to walking well.
That's great to hear.
The outlook for cats managed only medically is a bit less clear, mainly because fewer severe cases are managed that way, and we just have less long-term follow-up data.
Okay, so let's try and wrap up the key points from this deep dive on feline IVDD. It definitely happens in cats. It's complex. Different types exist.
Right, affecting cats of various ages, often middle-aged, but with a wide range.
And while there aren't those clear breed risks like in dogs, the signs, like hind limb weakness or reluctance to jump, are important clues.
Diagnosis relies heavily on advanced imaging, like MRI.
In treatment, often surgery for compression generally carries a pretty positive outlook, although recovery requires significant care and commitment.
That sums it up nicely. It might not be top of mind for cat owners, but knowing IVDD is out there is vital for getting cats the help they need quickly.
Absolutely. Which leads to maybe a final thought for you, our listeners, to ponder. Considering that some cats, even after recovering well, might need lifelong help with things like bladder management. What does that tell us about the commitment involved in caring for pets with chronic conditions? And looking forward, how might things like new therapies or maybe even assistive technologies improve life for both these cats and their dedicated owners?
Definitely something to think about.
Thanks for diving deep with us today.